This is the radius. This is the head. This is the neck. This is a radial tuberosity. This is styloid process. Okay. This is the head. This is the neck. This is a radial tuberosity. This is styloid process.
And what's the name of the bone again?
This is the radius.
Everyone?
This is the lumbar vertebrae. This is the spinous process. These are the transverse process. This is the pedicle. This is the lamina. This is the body, and this is the vertebral foramen. So lumbar vertebrae. Spinous process. Transverse process. Pedicle. Lamina. Body. Vertebral foramen.
Now go.
This is the foot, and this is the talus, the navicular, the lateral cuneiform, intermediate cuneiform, and the medial cuneiform. Okay, so this is the foot. The talus. Navicular. Lateral cuneiform. Intermediate cuneiform. Medial cuneiform.
Medial
This is
cuneiform.
the lumbar vertebrae. This is the vertebral body. This is the vertebral foramen. This is the spinous process. This transverse process. This is the lamina, and these are the pedicles. Okay. Body. Vertebral foramen. Spinous process. Transverse process. Lamina. And pedicle.
This is the vertebral end, the angle, costal groove, and then cartilage end. So rib. Vertebral end. Angle. Costal groove. Cartilage end. The hyoid. These are the greater cornu. Lesser cornu. And body.
Okay. Hand, and these are the carpals down here, which would be right down here. And they are the scaphoid, the lunae, the
Triquetrum.
triquetrum, pisiform, trapezium, trapezoid, capitate, and hamate.
Okay.
So scaphoid, lunae,
Quetrum. Yeah, good. Triquetrum. Good.
pisiform, trapezium, trapezoid, capitate, and hamate.
The spinous process, the transverse process, the body, the lamina, the pedicle, and the transverse foramen.
Vertebral foramen.
Oh, the vertebral foramen. All right, spinous process, vertebral foramen, transverse process, lamina, pedicle.
Okay.
This is the clavicle. This is the sternal end, acromial end, and tuberosity insertion. So this is the clavicle, sternal end, acromial end, tuberosity insertion.
The acromia process, the coracoid process, the spine, the supraspinous fossa, the infraspinous fossa, and then the glenoid fossa. Okay, so scapula, acromia process,
Acromion process.
coracoid process, spine, supraspinous fossa, infraspinous fossa, and then glenoid fossa.
Ulna. This is the alacranon process, the coronoid process, the radial notch, and the styloid process. So this is the ulna, the alacranon process, the coronoid process, the radial notch, and the styloid process.
This is the mandible. This is the coronoid process, condyloid process, ramus, the angle, the mental foramen, and the body. So, and this is the patella.
Now, ask him, or repeat it. Yep.
Okay.
Mandible.
Mandible. Coronoid process. Condyloid process. The ramus. The angle. The mental foramen. The body. And then this is the patella.
This is the medial malleolus. This is the groove for posterior tibial flexor digitorum longus. So this is the tibia. This is the medial malleolus.
Malleolus.
This is the groove for posterior. Tibial. Flexor digitorum longus.
Skull. This is the coronal suture. That one. The greater wings. The lesser wings.
That's of the sphenoid bone.
Oh, the sphenoid is the teal. The sella turcica is right here. The maxilla is right here. The palatine is right here. The ethmoid bone and the ethmoid bone is right here, the yellow. And then the cribriform plate is this little bone.
Good. Okay. Now get everybody to
Okay,
repeat again.
this is the skull. This is the chronosuture. This is the ethmoid bone. And the cribriform plate. The palatine. Oh, I forgot the lacrimals.
Sphenoid.
Oh, the sphenoid is the teal. The sella turcica. The lesser wings. And the greater wings.
Fibula. This is the lateral malleolus. And right here is the interosseous crest. So fibula. Lateral malleolus. And the interosseous crest.
Sternum. This is the manubrium. And this is the xiphoid process. Okay. Sternum. Manubrium. And xiphoid process.
Now go.
This is the humerus. This is the head. Anatomical neck. Surgical neck. Greater turicle. These are turicle. Deltoid tuberosity. The capitulum. Trochlea. Olecranon fossa. So this is the head. Anatomical neck. Surgical neck. Greater turicle. Lesser turicle. Deltoid tuberosity. Capitulum. Trochlea.
Trochlea.
And the olecranon fossa.
Olecranon. Good.
This is the body. These are the alas, the auricular surface, and the coccyx. Okay, so the sacrum. Body. Ala. The auricular surface. And the coccyx.
Tip. This is the ilium, the ischium, the pubis, the acetabulum, the the iliac crest, the obturator foramen, and the greater sciatic notch. So the hip, ilium, ischium, pubis, obturator foramen, iliac crest, acetabulum, and the greater sciatic notch.
That's the skull. That's the frontal bone. That's the zygomatic bone. That's the temporal bone. That's the occipital bone. That's the mastoid process. That's the styloid process. And that's the foramen magnum. So, skull. Frontal bone. Occipital bone. Zygomatic bone. Frontal bone. Oh wait, not frontal bone. Temporal bone. Mastoid process. Styloid process. And foramen magnum. This is the head. This is the fovea cactus. This is the greater trochanter, the lesser trochanter. This is the medial condyle and the lateral condyle. So this is the femur. This is the head. This is the fovea cactus. Greater trochanter. Lesser trochanter. Medial condyle. Lateral condyle. And this is the metacarpals. So the hand. Metacarpals.
Okay, there we go.
Yep.
This is the thoracic vertebra, and this is the spinous process. This is the transverse process. This is the lamina, pedicle, vertebral body, and this is the vertebral foramen. So, thoracic vertebra. Spinous process. Transverse process. Lamina. Pedicle. Vertebral body. Vertebral foramen.
This is the hand, and these are the phalanges. Okay, hand. Phalanges.
Go for it.
This is the foot. This is the calcaneus. This is the cuboid. And these are the metatarsals. So foot. Calcaneus. Cuboid. Metatarsals.
This is the tip. This is the ilium, the ischium, the pubis, the acetabulum, the obturator foramen, and the greater sciatic notch. Hip. Ilium. Ischium. Pubis. Acetabulum. Iliac crest. Obturator foramen.
Greater sciatic notch.